Good afternoon. This is Ed Salzberg. I'm the Managing Director of the Security and Sustainability Forum, and I welcome you to our webinar today on healthy cities in an era of climate change. The Security and Sustainability Forum is an educational organization. We convene experts from all over the world to produce webinars like this one, and I thank Island Press for making this webinar possible. We have an incredible panel for this session with years of experience in public health and especially the impacts of environment and natural systems on community health and also the role of health systems in planning and response. I'm really pleased that Dr. Linda Rudolph is going to be with us. She's the director of the Center for Climate Change and Health at the Public Health Institute. Gary Cohen, president of Healthcare Without Harm, and Cecil Corbin Mack, who is the deputy, Cecil Cohen Mark, who is the Deputy Director of We Act. Before we begin, I want to briefly call your attention to some programs I think that will interest you. First of all, our next webinar, Biting the Hand That Feeds Us, addresses unintended consequences of food law on nutrition and the circular economy. This is an Island Press webinar as well. Also, the National Council on Science and the Environment, conveniently, its next annual conference in January 2017 is on environment and health. It is the best place to go to be educated on these kinds of topics. It convenes experts from around the world, and they pull together science and science policy leaders. It's a pretty inexpensive conference. It's very affordable, and there's also an early bird pricing so that it makes it even more affordable. If you're in Washington or can get to Washington, it's in January of 2017. This is just a great event. I think it's the best event in DC if you're interested in climate impacts and sound science informing policy. Finally, Island Press launched the Urban Resilience Project a few years ago with support from the Kresge Foundation and the JPB Foundation. The project brings together thought leaders to cross-pollinate ideas on urban resilience and produces books, articles, and educational courses on the topic. If you go to this link, you can download a free ebook, also sign up for their announcements. It's just quite a great place to go to get a lot of education on urban resilience in a short period of time. Here's how the webinar is going to run. I'll introduce the speakers in just a slight more detail. They'll each be giving a presentation that'll take probably 30 to 40 minutes. We may go into discussion questions or that we predetermined, or we may go right to the questions and answers. You can download the slides, by the way, in the handout box in the GoToWebinar window, and also the two handouts that I sent out this morning, you can also download them there. So there are three things that you can pull down. And the recording will be ready either at the end of the day or tomorrow morning, and you'll get an email when it's posted. And I also ask that you take a brief survey at the end of the session. It helps us improve what we're doing, number one, and also we ask for your ideas for additional webinars, and we really appreciate that. So Linda, as I said, is the director of the Center for Climate Change and Health at the Public Health Institute. She's a former public health officer and public health director for the city of Berkeley. She's really devoted her career to worker health and safety and community health. We're just really fortunate to have her on this session to lead it off. She's going to provide an overview of health impacts and then go into some of the policy solutions. Gary Cohen, co-founder of Healthcare Without Harm and Practice Green Health. He's instrumental in bringing together NGOs and hospital systems that form the Healthier Hospitals Initiative. He'll focus on healthcare providers and healthcare systems in community resilience. And then finally, Cecil Corbin Mark, Deputy Director of We Act, who was instrumental in the formation of the Environmental Justice Forum. He'll focus on local resilience programs as a guide for community involvement. So thank you all for participating, and with that, I'm going to turn it over to Linda to get us started. And Linda, you've got to remember to unmute your microphone as well.
Thank you so much to Ed for hosting and to my co-panelists and all of you who are participating. Ed, do I have control here?
Again, there you go.
There you go, great. So many health experts and organizations now recognize that climate change is the greatest threat to human health of this century because it threatens our water, food, air, shelter, and security, what we humans depend on for our existence, literally. Climate change threatens human survival and is a health emergency. We have time today for only the briefest overview of the many interrelated health impacts of climate change, but one key point that I want to make, Ed, I think you should take control because I'm not seeing the slides react to my clicking. Great. One key point I want to make is that because climate change serves mainly as a threat multiplier, exacerbating our existing health problems, it poses an especially important risk for those communities that already suffer from stark, unacceptable health inequities, which is our other greatest health challenge. Next. Extreme heat is the leading cause of weather-related deaths and has already killed tens of thousands of people in recent years. People with chronic illness, those who labor outdoors, those who live in urban heat islands with few trees and lots of pavement, communities of color, and low-income communities who live more in urban heat islands are most at risk. And the number of heat deaths and the impact of heat on human productivity is expected to increase very significantly over the next several decades as heat danger days increase. Next. Rising temperatures also lead to worse air quality due to increased ozone and smog levels, longer and more intense pollen and allergy seasons, and higher dust levels. Heat increases the risk of wildfire, which doesn't just cause displacement and deaths, especially in firefighters, but also respiratory and cardiovascular disease due to extensive particulate-heavy smoke plumes. People who live in heavily polluted areas, again disproportionately poor and non-white, are at increased risk from the air quality impacts of climate change. Next. We often forget, but newsflash, water is life. Drought threatens the availability of clean and fresh water for drinking, cooking, and bathing. Tulare County, California, a poor rural agricultural community in California's San Joaquin Valley, serves as a harbinger of what increased drought looks like on the ground. In 2015, over 1,300 Tulare County wells ran completely dry, affecting over 6,000 residents in the county. California's drought also resulted in the fallowing of hundreds of thousands of acres of croplands, the loss of tens of thousands of jobs, the culling of thousands of livestock, and increases in respiratory disease, West Nile virus, and mental health problems. Experts believe that widespread crop failure due to severe drought in Syria led to the internal migration of over 1 million people, and that fueled existing tensions and unrest that precipitated the Syrian civil war. And just a reminder, drought caused the largest mass migration in U.S. history, the Dust Bowl, that forced about 2.5 million people to move out of their homes in the Plains states. Next. Climate change impacts agriculture and food production in many ways. I mentioned drought. Extreme weather events also cause crop loss, heat, rainfall, flooding. Rising ozone levels reduce crop yields. Warming waters increase the frequency and severity of harmful algal blooms, and a very large harmful algal bloom shut down shellfish harvesting all along the west coast for months last year. Ocean acidification is harming fisheries production around the world. Heat reduces cow's milk production, and rising CO2 levels reduce the concentration of key micronutrients in many staple crops. All of this contributes to rising food prices and rising food insecurity. obviously placing those living in poverty who already suffer high rates of food insecurity at greater risk of malnutrition, poor nutrition, and diseases associated with food insecurity such as diabetes, obesity, and hypertension. Next. So you've all seen the news stories about the widespread damage and displacement caused by extreme rainfall and weather events such as Katrina and Sandy. Low-income communities often lack disaster insurance and other resources that aid recovery after these extreme events. Hurricane Katrina displaced about 1.5 million people, many of whom never returned home, and one of the key reasons that kept people from coming back was the lack of affordable housing. Sea level rise threatens the homes of hundreds of thousands of coastal residents, and just recently the U.S. government announced the allocation of $48 million to relocate a Native American community in Louisiana, making them the first official U.S. climate refugees. Next. Many climate change pathways also impact infectious disease risk. Changes in mosquito and tick habitat change the patterns of vector-borne disease, putting new populations at risk of malaria, dengue, Lyme disease, and as we're now seeing in South Florida, Zika. Those in neighborhoods with blighted vacant lots are especially at risk, as small pools of stagnant water, for example in discarded tires, provide perfect breeding grounds for mosquitoes. Flooding also presents a risk of infectious disease from contaminated water due to sewer system overflows or to toxic spillage, again, particularly in older and poorer communities with aging and inadequate infrastructure. In the U.S., more than 50% of waterborne disease outbreaks are associated with extreme rainfall events. Next. And although we talk about it as a separate issue, mental health impacts accrue from all of the above impacts. Displacement and loss of livelihood due to climate change are clearly major stressors associated with anxiety, PTSD, and in some cases, epidemics of suicide. But increasingly, mental health professionals are recognizing chronic stress, sadness, loss, and grieving as communities around the nation and the world recognize that not only are their homes threatened, but so too is the future well-being of their children and grandchildren. Next. I want to quickly just look at how all of this comes together for some of our communities. In this case, let's look at Latino Americans. 4 of the most polluted counties in the nation are in California's San Joaquin Valley, where nearly half the population is Hispanic. 1 in 6 children there have asthma. Nearly 30% of California Latinos live in poverty, and Latinos have a high prevalence of diabetes. A large proportion of agricultural workers and construction laborers are Latino. These are all things that place people at higher risk for heat illness, for the health impacts of higher ozone levels, for more dust exposure, for higher rates, for higher food insecurity as food prices rise. And so this is just one example of how our economic work and living conditions really can exacerbate existing health inequities unless we pay attention. Next. So to summarize before I move on to sort of talking about what the public health community is doing and why health is an important lens for taking climate action, I just want to say that the health impacts of climate change are wide-ranging. They're happening now. They'll increase as global temperatures rise. They constitute an urgent threat to human health and survival. We cannot safeguard human health without maintaining the health of the planet on which we depend. Next. So if climate change is a grave health threat, how is it that a well-crafted response to climate change may be our greatest health opportunity? Next. You all know that greenhouse gas emissions result from our human activities, how we move about, what we eat, how we get to school or work, how we heat, light, and cool our homes and offices, how much we consume. But our daily decisions about these things are shaped by our transportation and land use systems. our energy system, our food and agriculture system, our economic system, and by the political system, the cultural narrative, and the power relations that shape all those systems. And those are exactly the same determinants and systems that have created our high rates of chronic illness and the stark health inequities that plague every community in the U.S. My colleague Larry Cohen reminds people that, quote, solution fixes many problems. Good climate solutions can help us create healthy people in healthy places on a healthy planet. Next. Coal-fired power plants are one of the largest single sources of greenhouse gas emissions, but coal kills at every stage of its life cycle, from mining to transportation to waste, and coal combustion releases a toxic brew of air pollution. Over 3/4 of African Americans live within 30 miles of a coal-fired power plant. The health benefits of reducing these climate and air co-pollutants by switching from dirty fossil fuels to clean, safe, and renewable energy and energy efficiency are really significant. A recently published study found that Obama's Clean Power Plan would avert an estimated 3,500 premature deaths in the U.S. every year and more than 1,000 heart attacks annually from air pollution-related illness. Next. Transportation now accounts for about 1/3 of all U.S. greenhouse gas emissions, and for air pollution that increases the risk for heart disease, asthma, and cancer. So steps to reduce vehicle pollution through increased fuel efficiency, low carbon fuels, and zero emission vehicles will have significant health benefits, particularly for people of color and low income people who are more likely to reside near busy roadways and are thus disproportionately affected by vehicle pollutants. Next. Our current land use, transportation, and housing patterns have increased our dependence on automobiles and decreased physical activity in daily life. Too little physical activity is associated with heart disease, stroke, diabetes, obesity, osteoporosis, depression, and overall premature death. That's why active transportation, walking, bicycling, and public transit, is such a critical strategy for reducing transportation greenhouse gas emissions and has potentially the most profound impacts on the health of our population. A large proportion of our trips are short distance trips that could easily be replaced with walking and bicycling if we provide the infrastructure to make that safe and appealing. If we have even a modest shift from driving to active transportation, we would see huge health co-benefits, reduced cardiovascular disease and diabetes of about 14%, which would be a very major public health achievement. Next. Similarly, our current industrialized and fossil fuel-heavy agricultural system is associated with pesticide illness, water contamination, antibiotic resistance, a diet heavy on processed foods that are associated with cardiovascular disease and diabetes. Livestock production accounts for a large proportion of global methane emissions, and we waste about 40% of the food grown in the U.S., contributing further to methane emissions from landfills. But 48 million U.S. residents live in food insecure homes. Transitioning to more plant-based diets, lower meat consumption, and local and sustainably produced food, and taking steps to reduce food waste would increase food security and significantly reduce many chronic illnesses. Next. I talked earlier about the increased risk of heat illness associated with urban heat islands. One strategy to reduce heat risks in cities is through urban greening: trees, parks, community gardens, green infrastructure such as bioswales. The health benefits of urban greening beyond reducing heat illness include reduced air pollution, more opportunities for physical activity, access to healthy foods, social connectivity, and green infrastructure reduces flood risk and increases filtration and capture of water for our groundwater aquifers. Next. Because climate change is such an important health threat, and because climate solutions provide such an important health co-benefits, the health message and the voice of the health messenger is very important. in eliciting support for climate action. Research shows that people understand that the health and equity opportunities are real and current, and they see health workers as trusted and credible messengers who work in and with our most vulnerable communities. The health voice, in partnership with community and environmental justice advocates, has been critical in moving a whole host of other key public policies, and we can do the same in supporting climate action. Next. Public health is already working on the front lines of climate change. In Tulare County, it was the local health department that was helping to distribute bottled water and setting up community showers for people whose taps had run dry. It's public health workers that are out testing for Zika in mosquitoes, spraying for mosquitoes, issuing boiled water advisories after flooding events, and public health nurses are providing critical services and support in shelters after natural disasters. Next. Health providers have roles across a whole spectrum, from what they do as individuals to their role in patient and community education, integrating climate risks into disease management plans for people with chronic illness, greening their own clinics and hospitals that Gary will speak about in more detail. And because they are such credible messengers, health providers play a really important role in educating the public and policymakers about the health impacts of climate change and why climate action is also action for healthy communities. Next. Just a few examples of what local health departments are doing. They're conducting vulnerability assessments to understand what the risks of climate change are to the health of people in their jurisdiction. Next. They are using those health assessments to help policymakers understand the potential co-benefits of different climate actions in their communities, and also weighing in on the health impacts of decisions that have huge climate and health impacts. So for example, it was a group of public health professionals that really helped the Oakland City Council decide to ban coal shipments from the city, citing the health risks not just to the local community but also due to climate change. Next. Local health departments are educating their own communities and educating their peers about how they can take action to improve the use of recycled water so we have more water available during droughts, or reduce food waste, or incorporate weatherization recommendations as they do home visits. Next. Next. So I want to just quickly tell you about one very exciting model program that could be implemented in many other places. The Network of Ethnic Physician Organizations associated with California Medical Association Foundation is training and supporting climate change champions, next, to talk to the public and policymakers about policies that impact climate change. So we've done a host of radio shows, television shows, op-eds, and legislative testimony on a variety of climate and health impacts and solutions. Next. I hope that you will all visit the website of the U.S. Climate and Health Alliance and check out our resources there, including our new Physician's Guide to Climate Change, Health, and Equity. And I thank you very much for the opportunity to talk with you.
Gary, you should have control.
Yes, hi, this is Gary Cohen, and thanks very much, Linda. I'm going to build on the arguments that Linda made, and really to talk about the role of the healthcare sector in this age of climate change. So just a little background. As a nation, we spend more money than any country on the planet on healthcare, typically twice as much as many, many European countries. However, we don't have healthier people as a result of it. So the cancer rates are 1 in 2 for men and 1 in 3 for women. We have a dramatic epidemic of obesity. We have millions and millions of people with diabetes, with asthma, with learning disabilities and heart disease. So even though we spend more money than any country, we don't have healthier people. And the reason is that we haven't addressed the social and environmental conditions that are making people sick in the first place. All of these conditions have environmental and social links. And as Linda said, climate change is added on to that as a force multiplier for making things worse than they are. If we take the pulse of the healthcare sector, we see that it is replicating the very contradictions of an economy built on fossil fuels and toxic chemicals and industrial agriculture. It is itself a large polluter. Healthcare is the second most energy-intensive sector in buildings. When we started our organization 20 years ago, it was the largest source of dioxin emissions because of medical waste incineration. It produces millions of pounds of pharmaceutical waste. It's a large user of toxic chemicals, and it serves up unhealthy food to their patients without any understanding of the connection between healthy food and healthy people. So if we took the emissions from U.S. hospitals, if they were a country, the U.S. hospitals would have more greenhouse gas emissions of the entire country of Great Britain. If you took the European hospitals all as an aggregate, they would have more greenhouse gas emissions of the entire country of France. So it gives you a sense of scale. So the problem that we have is that we're understanding that environmental factors are a key driver in human health outcomes. Hospitals and healthcare is a major contributor to the deterioration of those environmental health conditions. And if we then say, okay, well, how can we support healthier people? The solution is actually to change the very mission of healthcare, to go beyond treating individual patients with chronic disease, which is where we spend 75% of all of our resources in the United States, and move upstream to address the social and environmental factors that are making people sick. We can have a bigger impact. And inside of that, the healthcare sector is 18% of the entire U.S. economy, 10% globally. So if we can leverage the full force of their purchasing power, their political assets, their business, their role as anchors in community, it can have an enormous impact on the rest of society. So what we see in Healthcare Rather Harm is to transform the healthcare sector so that it not only reduces its environmental footprint, but it becomes a community anchor for sustainability and a leader for global health, environmental health and justice. So we've developed basically a comprehensive platform for the healthcare sector to engage in essentially a low-carbon strategy for the 21st century. And there's all these doors in which they can enter. They can reduce their waste. They can make the transition to renewable energy from fossil fuels. They can reduce their water use. They can leverage their enormous purchasing power to support low-carbon solutions. They can buy local and sustainable food, including antibiotic-free meat, including more sustainably produced meat, and they can support low-carbon transportation strategies. So we've coalesced that strategy into a challenge, the 2020 Healthcare Climate Challenge, to bring healthcare sector on board on the broader movement for a climate-friendly planet. To give you a sense of the the opportunity for scaling things quickly, our first effort was to try to eliminate mercury-based measuring devices in healthcare. And we started with one hospital in Boston, and it took us 17 years to go from one hospital in Boston to a global treaty phasing out all mercury blood pressure devices and thermometers from healthcare globally. Now in 2020, building on that momentum around mercury and the coalition and networks we've built, we're able to coordinate 75 participants representing more than 9,000 hospitals in 21 countries to commit to reduce their climate footprint and to lend their voice, as Linda was describing, toward policy efforts stemming climate change. We've also just finished a report for the World Bank to see how the World Bank can leverage their $12 billion of loans, loan guarantees to low and middle income countries to support low carbon development. So in many places around the world, there is no reliable energy. So rather than investing in fossil fuels, we're encouraging the World Bank and other multilateral loan agencies to leapfrog over fossil fuels and to start investing in solar power and solar and wind power in those countries. And we created a sort of 7 elements of a low carbon healthcare strategy for the World Bank, which includes changing the building design and construction to moving toward renewable energy and energy efficiency, reducing waste, supporting sustainable transport and water consumption policies, using procurement, developing resilience, and having overall coordinated system designs, so we're actually not telling people to go to the hospital as the place of first resort, but the place of last resort, and trying to localize healthcare delivery systems. So I want to just hone in on a couple of pieces of this. One is the level of resilience, the importance of resilience. One of the things we learned in Hurricane Sandy and Katrina is that the healthcare system wasn't prepared. So Memorial Hospital and many other hospitals in New Orleans failed. They were flooded. All the systems failed, and they had to evacuate people. The same thing was true in New York City with NYU Langone. Hospitals in the New Jersey area, the New York area, that had on-site power that could operate when the grid was down, they became places that people could come to receive treatment. They became places where people could charge their cell phones. And so we've worked with the National Institute for Environmental Health Sciences to develop a whole framework about how do we rethink, how do we design and operate our healthcare facilities so they can be the last building standing in an extreme emergency and address the additional patients and the additional trauma that everybody will face. And so all the people that are on the phone that are working in cities can be taking the checklists that were developed around this for the healthcare sector and work with their hospitals to develop resiliency plans for their cities. An example of investing in community resilience. So it's not just the infrastructure of the hospitals, but healthcare is such a large buyer, such a large purchaser, such a large user of energy that they can co-invest in more sustainable community energy systems. So Gunderson Health System, which is a large system in Wisconsin, they co-invested in a dairy digester to make biogas. They co-invested in wind turbines with Organic Valley to provide wind energy. They co-invested in solar power. And their investments are saving them money. They're saving them $2 million a year out of an initial $2 million investment. So what we're seeing is that for the healthcare sector, they can invest in resilience and renewable energy, and it will save them money over time, in addition to all the health co-benefits that Linda talked about. The other example, the other important role beyond resilience is around mitigation, is that we have this enormous sector, which is the only sector of our economy that has health and healing as its mission. If they can take that, their purchasing power, and help to move the economy toward a toxic-free, low-carbon future, it will improve the health of everybody in America. And so Kaiser Permanente, which is one of the largest systems in the country, both insure and runs hospitals, they've recently committed to become carbon net positive by 2025. In other words, they're going to produce more renewable energy as a healthcare system than fossil fuels that they use. They're also going to buy 100% of their food from sustainable sources, meat produced without antibiotics. They're going to reuse, recycle, or compost 100% of their solid waste. They're going to decrease their water use intensity by 25%. And 50% of all of the products they're going to buy are going to have a sort of safer chemicals criteria. So this is the high standard by which we try to now move the rest of the healthcare sector to adopt similar kinds of sustainability measures. What we see is that if you start to see healthcare as an anchor institution in many, many cities where they are some of the largest employers, then you can link their purchasing power with the purchasing power of other institutional buyers. So in Oakland, in Richmond, in a number of cities in California and a few other cities, we're starting to link the purchasing of school systems and hospital systems to create jobs, to create a more localized and regional economy, and to provide healthy food to people in schools, to people in the community, and to patients, because we all understand that food is actually medicine. And a sustainable food system will create an enormous cascade of positive health and economical benefits. The last thing I'll say is just to reinforce what Linda said about the role of health professionals. What we saw in the tobacco wars is that if you want society to quit smoking, get doctors and nurses to stop first. Get them to start talking to their patients. Get them to ban tobacco from institutions where they work. Get them to divest from tobacco. And I think we're seeing a similar kind of path around fossil fuels, is that healthcare professionals are waking up to the fact that their mission in the 21st century is to talk about climate change, is to support policies that will make this difficult transition from our addiction to fossil fuels to a renewable energy future. At the moment, there are more people around the world that die from the burning of fossil fuels at an indoor level and an outdoor level than AIDS, malaria, and tuberculosis combined. Double the amount, 7 million people per year. So as Linda mentioned, climate change is becoming the meta driver for global health. And Paris, we and many other organizations came together to talk about the importance of getting the healthcare sector engaged around climate change and supported the treaty process. And now I think it's really up to the opportunity is to move out from that global treaty and to create all these policies that cascade at the state and local and institutional levels to bring healthcare professionals on side with the larger movement for climate solutions. So I'll stop there. Thanks very much.
You did have this one last slide, Gary, that I've seen before, which certainly makes a lot of sense.
Yeah, I mean, at the end of the day, right, it doesn't even have to be about climate change. All these other things are going to work in our favor to create a much more sustainable society.
Well, thanks, Gary, and thanks, Linda. And I, too, want to join both my fellow panelists in thanking Ed Salzberg for bringing us together, and Lori Mazur from the Island Press and the folks at the Kresge Foundation for supporting the work of really bringing communities more into an engaged process around climate resilience through their own voices. I'm Cecil Corbin-Mark. I'm the Deputy Director of We Act for Environmental Justice. And I think I am going to be able, well, Ed, you may, let me see, double click. And, okay, there we go. I'm able to do this. All right, great. So just a little bit about We Act. We go by the name We Act for short. And since 1988, we've worked to build healthy communities by ensuring that people of color and or low income participate meaningfully in the creation of sound and fair environmental health and protection policies and practices. We are located in Northern Manhattan. We are a membership-based organization. Northern Manhattan, for those of you who are unfamiliar, is just about 7.25 square miles. It's about 600,000 people. By way of comparison, if any of you have ever been to Washington, D.C., Washington, D.C. is about 64 square miles and has about the same population. Or if you wanted to go on a grander scale, Northern Manhattan has almost as many people as the entire state of Alaska, which for those of you who know your geography is actually the largest state in the nation. For those of you from Texas on the phone, no, you're not the largest, but you're big. We have an office in Harlem. It's our headquarters office. And we have an office in Washington, D.C. And Northern Manhattan, where we're based, is a majority Latino and African American community. If we talk about I'll talk a little bit about our theory of change in a second, but just to give you a sense, as a membership organization, we started out as a membership organization, and for many years our membership went dormant, and in the last 3.5 years we've relaunched our membership and gotten ourselves back up to 500 active members. Those members are primarily from Northern Manhattan. We have two types of membership into the organization. One is called Reaction, and that's for people who actually live or work in Northern Manhattan. And then we have Vision members who are outside of that geographical boundary of Northern Manhattan. Our leaders in the organization do what's known as our Environmental Health and Justice and Leadership Training Program. It's a 3-month training program in all of the key focus areas of the organization. We hold a graduation ceremony and issue certificates, and all of the courses are co-taught with leading experts in the various fields and academics as well. We have, for our members, a monthly membership meeting. It's the second Saturday of every month, and there's a planning committee that works to help guide the work of our membership, and a series of working groups, and we engage our members in events and rallies fairly frequently. The next slide just gives you a sense of our key focus areas that we work on. We don't work on all of these focus areas at once, but we have a process of prioritizing based on key issues and concerns that are rising up in the community, as well as the availability of resources to fund the work that we do. So the 8 key areas are affordable and equitable transit, clean air, climate justice, food justice, open and green space, sustainable development and land use, toxic-free products, and waste, pest, and pesticide reduction. Okay, there we go. And we work off of a theory of change, and that theory of change involves community-based organizing as the heart of what we do to gather both information and key concerns. What we do with the concerns that residents bring to us as we organize in the neighborhoods, going door to door and knocking on doors, as well as holding community meetings or inviting people to our membership meetings, is that we learn of key concerns and then we marry those concerns to the research expertise that we have with a series of long-standing partners from Columbia University's NIEHS-supported Northern Manhattan Environmental Center, as well as the Mailman School of Public Health Children's Environmental Health Center at Columbia University. We also partner with Mount Sinai School of Medicine. We've partnered with Fordham University Law School, University of Pittsburgh, and a number of others, including the City University of New York. We then take the research findings that we get and turn anecdotal concerns that are raised by residents into evidence-based policy campaigns. And that leads us to the third part of our model in terms of advocacy. And that advocacy comes in the form both of policy change, both budget and legislative approaches. And we do that legislative or budget work either at the city council level here in New York City, or in Albany, the capital of New York, or Washington, D.C. And in case you're wondering, the where we target our policy work really depends on the issue that we're looking at, because what we're attempting to do is engage people of color or low income in the process of developing policies in the places where they are rooted. So, for example, if we're working on food justice, a lot of that happens to be focused at the federal level or the state level, and so our policy campaigns will target that. Currently, we're working on an asthma-free homes bill to essentially get landlords to be more responsive to some of the underlying triggers of mold, and such as asthma triggers such as mold, and so that's at the city council level. But our advocacy work also involves litigation. We're currently involved with a couple of other organizations in suing the EPA, for example, around their lead dust standards, having not been improved in several years. So that's our theory of change. Our programs and the work that we do, in order to achieve our mission, we've run a number of priority campaigns and initiatives. And I won't go into depth of all of our campaigns and initiatives, but I'll focus just a little bit, especially on our clean air work and our clean power, cleaner communities work, as well as the Northern Manhattan Climate Action Plan. So if we look at sort of the indicators of the coming climate crisis and the existing and the current climate chaos that we're experiencing in Northern Manhattan, I've just put in these maps here to be able to give you a clear sense of some of what's going on. So for those of you looking at the screens right now, you'll see I'm circling sort of the northern tip of Manhattan here, and that is the area that we are working in, where you see the, making sure that the cursor gets up there. So you're going to keep your eye on that area in all of the maps, and we'll just sort of go through them fairly quickly. So the first map is one that was put out by the New York City panel on climate change, and it's essentially looking at the 100-year flood zones for New York City. Now, I will tell you that even though these are 100-year flood zones, there are many areas in Northern Manhattan that experience flooding, especially at 125th Street, which is one of the more famous thoroughfares in Harlem that cuts across from West Harlem to East Harlem. You see the actual arrow going at this particular point. And you will notice that on the floodplain map, you will see that at the very eastern tip of Harlem, East Harlem or El Barrio, Spanish Harlem, you will see that there's a little purplish hue that's going on there, indicating that this is one of the areas prone to problem, obviously. If you flip over to the next map, the one that has the bright yellow and red and orange coloring, that is a map that depicts some of the asthma emergency department visits among children all across the city. In many instances attributable to particulate matter. And you will see once again that the Northern Manhattan area, again where you see me sort of tracing with the cursor, is amongst the highest in the city. In fact, East Harlem and the South Bronx, which is right across from East Harlem, where I have the cursor pointing right now, are the highest asthma zip codes in the entire city and drive the asthma rate for the nation. The third map is one just to give you a sense of the urban heat island effect in the city of New York. It is a very hot place, as you can well tell from the points on the map. Lots of purplish hues, which are on the other end of the spectrum in terms of the heat index. And so that's obviously a key problem for many people in the city. And once again, Northern Manhattan, obviously, as you can see there, is got a lot of problems. And then just along 125th Street, you can also see some of the orangish, yellowish hues coming out there as well, indicating some of the hottest places in the city. So in response to some of these in response to some of these challenges, what we did was we've been engaging residents in the process of understanding some of the climate impacts, and it doesn't take a lot for people to recognize that there are problems. In fact, they come already with that knowledge. And so one of the things that we were able to do in response to some of the challenges that we were seeing with regards to climate is recognize that a key problem in New York City is that we're generating both the vast majority of our greenhouse gases from our building stock. And a key issue with regards to the building stock was the heating oil fuel that was being burnt in many of our buildings. Now, this was a very good nexus in terms of pushing a policy agenda that both tackled the issue of the climate crisis, because by cleaning up the fuels that we burn in buildings, we are able to ultimately move people from a place, and by people I mean landlords, move them from a place where they were helping to contribute to the city's highest burden of greenhouse gas emissions from this sector, the building sector, to a place where they are now sort of reducing that burden, and then having the co-benefit of actually dealing with the fact that burning of dirty fuel oil in our homes was also contributing to respiratory illnesses in our buildings. So from left to right on the pictures on your screen, a building in New York City, and you can see the black smoke coming out, obviously not a good sign, clearly an indication that something is going wrong in that boiler process. And number 2 picture, you can see a boiler room of a building in New York City, and a superintendent who actually works on obviously maintaining the boiler and dealing with the challenges of older boilers in our city is also one of the big challenges for many of the older housing stock in our neighborhoods. And then the 3rd picture you see is our We Act member Alicia Barksdale with her grandson in arms, and Alicia is actually looking out of her window, and if you notice right over there, there's the chimney for the building, or one of the chimneys for the building that she lives in. It's a huge housing complex that is notoriously bad for its maintenance policies, and burning number 6 heating oil was one of those challenges. Anyway, so we've worked with people like Alicia and our membership to actually influence the then Bloomberg administration to both change the things that they were thinking about with regards to a clean heat policy, which ultimately became Local Law 43. Local Law 43 was passed in 2010. And what it did was it amended the city code, the city's administrative code, to ban the use of number 2, number 4, and number 6 heating oils containing less than 2% biofuel by volume. It also reduced the sulfur maximum in number 4 heating oil from 3,000 parts per million to 1,500 parts per million. And it established a civil penalty of up to $10,000 for the use or distribution of heating oil not meeting those particular requirements. The Department of Environmental Protection was the agency charged with enforcing this and developing the regulations to actually operationalize the law, and they required buildings to replace number 6 heating oil with cleaner heating fuels by July 1 of 2012. And they were, the policy was fuel neutral, and I'll come back to that in a second. And so it said, you know, they could step down to either number 4 heating oil, and then ultimately get to number 2 heating oil by 2030. So as I said, it requires buildings to convert to heating fuel oil number 2 or its equivalent upon boiler or burner replacement on or retirement by January 1st of 2030, whichever occurs sooner. That idea of sort of pushing for the operators or the landlords themselves to actually move the buildings to cleaner fuels is something that we are in the process of testing with some of our research partners to see whether or not there have been improvements, and maybe at a later date we'll be able to release some of the results of that work. It makes the renewal of building permits sort of the key mechanism for operationalizing and enforcement of Local Law 43. And we engaged our residents also with the Bloomberg administration by having them testify at City Council hearings for the actual passage of the laws. We did trainings for tenants in various buildings that we knew were on the list of sort of dirty fuel users based on city building records. And all of that training that we did took place through our environmental health and justice leadership training, which I talked to you a little bit about earlier. We also held community meetings about the clean heat policy, and we urged the Bloomberg administration, through the testimony of our members and residents in Northern Manhattan, to actually change some of the financial packages that they offered for buildings in Northern Manhattan, because we were very concerned that the implementation of a law like this could also have other types of blowback, meaning that the landlords would then pass on the required either burner replacement or improvements onto the rent rolls as modified capital improvements, and so, or major capital improvements, sorry. And so we wanted to make sure that this policy didn't have that kind of adverse effect, and worked with the Bloomberg administration to work with their contacts in the financial industry to prepare a variety of financial packages and incentives to help landlords, especially in the lower income bracket, or smaller landlords, not the large corporate landlords, through this process of transition. The next slide I wanted to show you, if we, oh, there we go, it's moving, is really about more community residents being engaged in the policy of in the process of developing climate resiliency plans. And here I'm going to shift to talk about our Northern Manhattan Climate Action Plan. So the photograph on the left is the picture at the end of the People's Climate March. This is some of the contingent of We Act members that actually made it to the very end of the march. That was an amazing effort, and We Act, myself included in particular, served as a member of the steering committee that helped organize the entire march. We brought out more than 400,000 people. For those of you who don't remember, it was a great day in New York City, and We Act was able to mobilize 120 people to actually participate in the march itself, and you can see the remaining members who made it to the very end with us. So. The second picture, the one in the middle, is a picture of us kicking off our Northern Manhattan Climate Resiliency Planning process, a Kresge-supported effort to help us develop a climate resiliency plan that clearly articulates the voices of low-income people and people of color. One of the challenges, and you can see this embedded in our theory of change, is that we believe that a lot of policies have been made without the engagement of those most directly affected. And our efforts are very much aimed at trying to transform that particular policy practice, that particular practice of developing policy in our city, in our state, and hopefully in our nation as well. And then on the far right, you will see two young women who are members of We Act, and they were engaged in an effort up in Albany to urge the New York State legislature to pass something called the New York State Climate and Community Protection Act. And that's yet another coalition that we are part of to essentially advance a series of policies at the state level that help us deal with both climate resiliency at the same time as creating jobs. So I want to dive in here a little bit more into the Northern Manhattan Climate Action Plan, which is our next slide. This, for those of you on the phone and participating, is your eye test for the day. So if you can read this without either moving closer to your screen or actually using glasses, then you're in great shape. I, on the other hand, am not, and so I apologize for the size of this, but I wanted to make sure and get the richness of this particular plan down on the screen for you, and it's a bit of a challenge, but I'll talk you through it. This climate resiliency planning process we undertook with the support of the Kresge Foundation, and we were essentially engaged for 9 months in reaching out to members of the Northern Manhattan community. We held a variety of planning meetings all across Northern Manhattan. We process known as serious games, and actually it was quite fun. We, put out flyers inviting people in English and in Spanish to come participate in the climate games. Don't worry about looking at the Game of Thrones. You need to come to the climate games. And as a result of that outreach, we knocked on doors. We, sent mailings out to people. We put things up on local media. We used social media to engage people, and we were able to engage something on the order of about 400 to 500 people in the planning process throughout its 9-month stretch. And you know, we were very happy with the process. We were able to provide meetings and have translations so that folks who spoke Spanish could also be engaged in the process. We provided food. We engaged members in the serious games planning process, where we took them through a number of increasingly chaotic climatic scenarios, and then moved to a discussion of what were some of the solutions that they would see if, for example, they were in a situation like they were in Superstorm Sandy, where the power went out, or what would we do to make sure that people who in our community might be differently abled were able to be protected in the process, and that we were working together as a community and achieving greater social cohesion to make sure that we not only survived through the storm or the climate crisis, but to actually come out on the other end thriving. Key elements that came out from these discussions is that people talked about really wanting to have greater energy security in the wake of the blackouts that followed Superstorm Sandy. People talked about really trying to figure out how do we have more locally based power so that we are able to avoid those kinds of situations where we're dependent on one kind of centralized grid. Folks talked about having renewable energy so that it could connect to the idea of taking more fossil fuels out of the power system as it currently exists. And so our energy democracy concept that comes out of this particular plan really has us building local microgrids, engaging affordable housing owners and operators, engaging something known as HDFCs, Housing Development Finance Corporations, which are buildings that were formerly tenant buildings, and then the landlord abandoned the buildings, and the city put them through a program to become low to moderate income cooperators. These buildings have an income earning cap, and so they are really some of the last bastion of affordable housing in the city. And what we're doing with them is we're trying to aggregate them into a broader pool and then make those buildings a part of an RFP that goes out to a set of solar providers. And those solar providers will then have to bid on the job, and hopefully by pulling this larger group of people into an aggregated RFP, we will be able to drive down the cost of installation across the board for the number of buildings that we have participating. We have a number of buildings that have signed up and are agreeing to be a part of this process, and we have a number of buildings that are going through assessments at this particular point. Our hope is that as we continue to move forward, we will be able to ultimately build a local microgrid by actually having solar panels on many buildings, some storage in some buildings, and move the process forward of actually building locally based microgrids to create resiliency. In the end, what we hope is that we're able to both provide jobs. We run a green jobs training program here in partnership with a couple of unions. And we're hoping to be able to put into the RFP a requirement that there is some solar training, not training, but the use of some of the people who we've trained on solar panel installations as well moving forward. A second key concept in the one last thing about the energy democracy piece is that part of the idea here is to also reduce the financial burden and to reduce energy insecurity of some of these homes in northern Manhattan by also making sure that they adopt energy efficiency measures as well. And so we work with a number of folks, NRDC, Enterprise, et cetera, NRDC being the Natural Resources Defense Council, and Enterprise, to really try to push this notion of energy efficiency and to get them engaged in doing both the solar as well as things like solar thermal and other energy efficiency measures to really drive down their energy costs and hopefully stabilize folks in homes that are often threatened by gentrification. Another key concept that comes out of the plan that residents developed in partnership with us was this idea of making sure that we had more emergency prepared residents. So training people in things like CERT, but also pushing CERT being community emergency response teams, a FEMA sort of supported training process that the city offers, FEMA being the Federal Emergency Management Administration, and really making sure, however, that these programs are much more culturally competent and culturally diverse in terms of the way in which they reach out to people and approach folks in our community. And we also have folks engaged in a partnership with an entity called City as Living Laboratory to build a emergency kiosk prototypes that can then be replicated in multiple places across northern Manhattan. We are working with the city's Office of Emergency Management, and this is an ongoing project for us. And then finally, the concept of social hubs. The idea is one of the things that we heard more often than not in the planning process was that we need to have more places to really continue the planning and make sure that more people are directly engaged in developing greater community resiliency over the long haul. And so we have folks participating in taking some of these ideas and concepts that are in this plan into a process known as participatory budgeting here in the City Council of New York. And so we will be engaged in budget policy to try to advance some of the projects, whether it's the locally owned microgrid or the emergency preparedness kiosk, et cetera, and other types of things that we want to do. So all of this is, about keeping in mind that there are health benefits. Clearly, the things that we're looking to do with regards to getting more local microgrids built in northern Manhattan is help reduce the amount of mercury exposure from the fossil fuels that are used to sort of produce energy in our city at this particular point. We're also looking to reduce particulate matter, which can contribute to respiratory system illnesses, cause lung cancer, as well as asthma and other respiratory ailments like COPD, chronic obstructive pulmonary disease. We feel that it is critical that we begin to take more megawatts of power out of the fossil fuel generated old antiquated grid system and put it into put those megawatts into more renewable, locally based microgrid systems that are more locally controlled, that have an opportunity for local employment, that can also reduce things like damage to the cardiovascular system that can then lead to coronary heart disease, heart attacks, or other congestive heart failure. And the more electricity that we are using from renewables, the fewer asthma attacks we will have, the cleaner our air will be, and the greater our contributions to improving the climate crisis moving forward. And the more we use less electricity from fossil fuels, the less electricity we use, period, the less fossil fuels we will need to burn, and therefore displacing fossil fuels with energy efficiency reduces pollutants and helps further fuel a healing of the climate as well. So through this, I hope you can see that WEAC's impact has been really in sort of bringing communities into the process of helping to shape policy to develop climate resiliency plans. We've spent the last couple of decades developing a reputation for creating policies and practices that are engaging of local folks, reflecting their views, partnering with academic institutions to build evidence-based campaigns, and partnering with city government and state government in some instances to help move the bar forward in terms of developing better civic architecture, if you will, and civic musculature to help change policy in a more hopefully timely way as we continue to move forth in these models of practice. So with that, I will end and say thank you very much.
Wow, thank you, Cecil, Linda, Gary. That was just a tremendous set of presentations. I did have some questions that I was going to maybe roll into, but you were so comprehensive, I'm not sure that any of them are really left to answer. You really did focus, I thought, really well on kind of shifting the healthcare sector from individual patients to a broader concern for the community. And I thought that you all just did a brilliant job on that. So Linda, why don't we just roll into audience questions? instead of some of the ones I have that I think you've already answered anyway.
Great. We have a couple of questions asking about our current environment where we're sort of seeing an increasingly hostile anti-science movement, including denial of climate change and the human role in creating climate change. Gary and Cecil, I'm wondering, how do you counter the current political refusal to see the dangers of climate change, and how do we convince our policymakers that this is a problem that really needs to be taken seriously and urgently?
So this is Gary. I'll start. There are a number of states in the United States where we've built a healthcare climate council, and there's 17 large healthcare systems that are in this council, and the whole point of the council is to exercise their political muscle in support of climate solutions. So in states like Washington, Minnesota, California, Oregon, Massachusetts, Michigan, even Virginia, in the Northeast, New York, it's very easy and possible for the healthcare professionals to talk about climate change as a health issue and to really focus on climate change. This is what we're doing this. In a number of red states, what a number of the hospital systems are doing is actually not talking about it, about climate change. They're talking about fossil fuels, and they're saying fossil fuels have these enormous impacts, and that we in the healthcare sector have a responsibility to reduce our own use of fossil fuels, as well as support our communities to make this transition, and our employees. So the slide I showed about Gunderson in Wisconsin, it's in the middle of coal country, and the CEO doesn't necessarily talk about climate change, and yet they've become one of the first healthcare systems in the country to be carbon neutral. They're offering their employees discounts to put solar power on their homes, and they're doing all sorts of education around this. So I think we're slowly building up the muscle around being able to call it out in many places, because as you said, Linda, the health framework is the most powerful, defensible framework in which to be talking about climate change, and it's the one that touches people most personally.
Hi, this is Cecil. So just very quickly, for me, this question starts with really empowering or reconnecting people to the power that they hold in our democracy. You know, you do not hear this sort of foolishness when it comes to talking to regular people. People understand that there is a problem, and I have witnessed that, you know, they are thankful for information that helps them connect the dots or clarify understanding based on science. And ordinary people and regular people are not talking about these issues in ways that are denying that science is saying one thing or the other. The ordinary people barely talk about science anyway. So that said, I think that's a key first step, right? We've got to make sure to get this information out to regular people, engage them in a process that's meaningful, and connect them up to creating change with the policies that are being sort of developed. I think Gary is right to sort of be clear that our political geography is, you know, such that there are certain places where you have to bring a different language, you have to do some translation, but it doesn't mean that you cannot effectively talk to folks in different places. I'll give you an example. The Cleaner Communities program that I mentioned at the outset as one of the campaigns that we're engaged in has us working in both Michigan and Mississippi, both of whom at this particular point are under Republican leadership. And you often find that is a major talking point for Republican governments where they're located across the country, that, you know, this is, climate change is not real and the science is bogus and all this sort of stuff. What I have found is that, particularly in a place like Mississippi, where we've been dealing with environmental justice organizations and other organizations and institutions in a process to work on the Clean Power Plan, knock on wood, once the Supreme Court in a couple of weeks, actually, or actually a couple of days, makes a ruling on moving forth with it. The idea for these states is that, they can't necessarily talk about climate change per se, but a state like Mississippi was hit by Hurricane Katrina and clearly understands the impact that that has had on its residents. And so you begin to talk about, what does it mean to do coastal restoration? What does it mean to, how do you wrap these conversations around health into those things that the state is moving in an effort to help its citizens recover? So that's one way. So you latch yourself and attach yourself to a vehicle that's moving, and use the skills of translation that I think we've all learned, particularly as 501c3 organizations, to navigate in some of these more politicized processes.
Great. We have a couple of other questions about, what other kinds of community organizations are all of us working with, and particularly how can we effectively utilize community resources like libraries or schools to increase awareness of climate change and its health impacts?
I'll lead off. This is Cecil. So we partner with schools around our environmental health and justice leadership training. We're using that as a pipeline to funnel more young people into our organization. We partner with other organizations. At every membership meeting that we have, we are registering people to vote. I know that I mentioned that we had 500 active members. One of the things that I wanted to point out to people is that in the recent set of elections, even though 500 may not sound like a lot of people, and we're continuing to build that number, we're partnering with other organizations all the time, because in the most recent primary elections, a Senate seat was literally won by a mere 300 votes between the two candidates. And so when you think about those small numbers to move and engage people, it becomes really critical and important to continue building membership like that and to be registering people to vote. So we partner with other community-based organizations, especially affordable housing operators in our community. We also partner with folks who are operating other educational organizations in our community as well, arts organizations as well. So we run the gamut, and our partnerships are critical to helping us advance our work, especially community-based work partnerships.
Gary, do you want to say anything about that?
No, there's an interesting moment that's happening in the healthcare sector with hospitals, where they're trying to learn how to partner with other community members. There's a requirement under the Affordable Care Act that requires hospitals to conduct community health needs assessments for the first time in order to get reimbursement. And what that means is that they actually need to talk to people. They need to figure out, look at databases, where the biggest health issues are, where's the violence, where's the food insecurity, where's the heat stress, where's the transportation problems, where's the asthma. And then they're supposed to align a lot of their community health programs, including their community benefit expenditures. This is the pot of money that they have in lieu of paying taxes that should be going to community health. So it creates at least the opportunity for these hospitals to invest in community partnerships with other nonprofit organizations to build sustainable food systems, to do what We Act is doing in Upper Manhattan and many other organizations. And so we've been encouraging the 1,300 hospitals that are in our network to begin to make investments and grants to sustainable agricultural partners, to environmental justice organizations, to many other public health educators in the community to educate people around these sets of issues and to mobilize people.
Linda, this is, sorry, go ahead, Linda.
Go ahead, Cecil, I'll chime in.
So this is Cecil again. I wanted to just say, and I'm thankful to Gary for the work that they're doing around this, but I just want the attendees to the webinar to realize that this is an uphill challenge, because what has been happening in our experience with the hospitals here in northern Manhattan is that they have really sort of become quite insular. We had invited them, for example, to participate in our Northern Manhattan Climate Action Planning process in a way with an eye towards actually opening their eyes towards opportunities that they could invest in terms of helping us build a microgrid, and other things as well around emergency preparedness, because this is a natural fit, you would think, in some instances for hospitals who have, you know, these central heating and cooling systems, or large heating and cooling systems, that they could also use those to help a microgrid get off the ground, as well as helping, you know, community residents really deepen their skill in terms of emergency preparedness. But it's a challenge. I think that hospitals have, you know, taken sort of at least the hospitals here in northern Manhattan have taken the sort of approach of being more insular about that planning process. And so one of the things that we've undertaken as an organization is to really study the Affordable Care Act, and to really try to begin to empower local community organizations, community-based organizations, with a training that we're ultimately going to run in coming months, as to how they could sort of push hospitals to really be more open in the process of developing these community needs assessments, and rather than just sort of taking those resources and developing pamphlets for you know, asthma or something like that, really thinking about these in these resources in a much more comprehensive way. And then the second point is that the community benefits pot, rightly so, is the right place to start. But hospitals as a whole have to change their business model under the Affordable Care Act. And what we need to get them thinking about is more about how are they investing with larger pots of money in housing, in other infrastructure in our community, as Gary was alluding to, or saying very directly, not alluding, sorry, because that's the more transformative piece that we need from them.
This is Linda. I just want to mention that every local health department around the country, some in cities and some in counties, also do regular community health assessments and community health improvement plans. And around the country, they're starting to integrate climate change into those assessments. So, for example, Macomb County in Michigan is exploring how to integrate climate change into their community health assessment, and particularly how to look at some of the issues relating to flooding, since they had a big flood there a few years ago that displaced about 20,000 people. Philadelphia's started a pretty big coalition that initially was focused on the impacts of climate change on asthma, but has now broadened to really include a much more comprehensive climate adaptation strategy. Milwaukee, the health department is doing a really interesting project with community garden providers, some homeless shelters, and nonprofit that does rainwater harvesting, to look at how they can build resiliency to flooding and build community food resilience at the same time. So I really would encourage those of you that aren't familiar with your local health departments to check out what they're doing and where there's climate change resilience connections that you can work with. So speaking of food resilience, we got a couple of questions about, you know, how in many communities all our food comes from a global supply chain, and there's almost no production or consumption of local food. What can communities do to become more food resilient to prepare for the impacts of climate change and coming disruptions of the global food chain?
I'll start. This is Gary. We've taken that issue on because in healthcare, the largest cost to the healthcare system in the United States is obesity and diabetes-related health issues. And so there's this realization that the food system is completely broken and that it's impacting on our ability to pay for the healthcare system. And if we don't turn that around over the next 20 years, we'll bankrupt the entire healthcare system. So we need to address these chronic diseases as a systemic issue. And we've been working with now hundreds of hospitals to begin to change their purchasing practices to support more local and sustainable agriculture. So sort of getting them to partner with farmers and then becoming a guaranteed market for farmers to bring their food to the hospitals. And in many communities now, starting to link up with the school systems. So the idea of communities using institutional purchasing, schools, universities, hospitals, as drivers for more regional and sustainable food systems is a very, very powerful idea.
This is Cecil. I think that obviously this is a big issue, and you can see that it was one of our focus areas of work. We are not doing as much work as we were in the last couple of years on that due to funding constraints, but what we were doing was actually working, and Gary picked up on this, about in the school systems, really trying to get school policy to reflect more requirements around local purchasing, and getting more schools, particularly in northern Manhattan, to actually have working kitchens. I mean, one of the things that the move towards more highly processed, sugared, salted foods did was that it sort of created this entire sort of microwavable culture. And so kitchens were removed from schools across the city, and part of what we were doing was working with organizing parents in the school to really push on administrators to bring those kitchens back and to also, as I said earlier, change the policy so that there's more preference for buying local in an effort to cultivate, no pun intended, a broader, more sustainable local economy. I think that's a key part of it when you think about the fact that just in a place like New York City, and I'm sure New York City schools produce 1 million meals for kids every single day. I mean, you can imagine the impact of that in terms of vehicle miles traveled and greenhouse gas reductions that are possible if you begin to localize more of that. We were able, in our research of the system, to uncover the fact that in New York City school system, we were doing things like, getting apples from New York State and then literally shipping them to China to be processed to then be shipped back to the United States. And, stuff like that is just a little nuts in my mind.
Thanks. So I think we just have time for probably one more question. We've gotten questions about, local and state public health departments and healthcare providers are stretched really thin. Community-based organizations also are very resource poor often. How do we build capacity in all of these different places to address climate change? And what do you say to people who think that there's other more urgent and pressing issues that are more deserving of our limited and stretched resources, like poverty or food insecurity or community violence? I'll start this time. My answer is that, climate change really is urgent, because if we don't address it now, these other problems will all these other problems will continue to get much, much worse as a result of the impacts of climate change. And we know that we can take actions that address health problems and our issues around power and other community determinants of health at the same time that we address climate change. So we have about 5 seconds for each of you to chime in.
I agree that solving climate change, if we do it well, will solve all sorts of other problems as well in society.
This is Cecil. I mean, I start talking about things like, do you like beer? If you like beer, then you got to care about this problem. I mean, you know, it's connected to everything. And all jokes aside, it is connected to everything. And if we are able to effectively deal with the climate crisis, then we will deal with income inequality. We can deal with, you know, food security. We can deal with, you know, the death rate in terms of heat. There's so many ways in which this is a win-win bottom line, multiple bottom line solution, co-benefits all around. So yeah, I would agree.
Great. So I think we're just about out of time. I'm going to turn it back over to Ed.
Thank you, Linda, for doing a great job moderating the questions. And thank you, Gary, Cecil, and Linda, for just a great discussion. I mean, you had something for healthcare providers, for community organizers, for citizens, for municipal government officials, also the various sectors that are involved in the overall economic system that drives urbanization, the energy industry, building owners. It was just an incredible session, and I really appreciate it, and I'm sure the hundreds of people that were on the session and stayed to the very end really appreciated it as well. The recording is going to be available either this evening or tomorrow morning. You'll all get an email with the link to the post. I ask that you take the survey at the end. That does really help us. We read what you write and take it seriously. And also remember to download the PowerPoint and the 2 handouts that went out this morning. I also invite you to our September 27th webinar on food law and the consequences there. And also remind you of the early bird pricing on the National Council on Science and Environment's conference on integrating environment and health. As I said, it is the best conference if you want to meet the policymakers and the science leaders in the field, not just in the United States, but from across the globe. And then finally, take a look at the Urban Resilience Project. There are ways to get involved in this program to offer your expertise, and then just to learn a lot from the dialogue and the experts that are brought into the program. And with that, I want to thank all of you who stayed on to the end, and again thank the panelists who just did a marvelous job. And with that, I'm going to end the session.